A very good evening to one and all. It is my great pleasure to warmly invite you to the second day of career guidance for 10th, 11th, and 12th grade students. We will now start with the invocation. We welcome all the dignitaries, faculty members, delegates, students, staff, and parents. First and foremost, I would like to introduce our distinguished chairpersons. To start with, we have Dr. Kiran Kishore, BSc Respiratory Therapy 2013 to 2017 batch AIMS Kochi, now a final year MBBS student in Odisha National Medical University, Ukraine.
Next, we have Shri Prasad BG, Chief Transplant Coordinator and Senior Lecturer and Program Coordinator for Allied Health Sciences. He is also an alumni of AIMS Kochi.
Now moving on to Brahmacharni Sai Bala, the Nursing Director in AIMS and also an alumni of the same.
Next, we have the most awaited part of the day, for which I welcome the speakers, Dr. Aishwarya Sudan, MD Resident Pharmacology AIMS Kochi, to shed some light on the topic career opportunities in allied health sciences. Over to you, ma'am.
Namaskar and good evening to all. I'm Dr. Aishwarya Sudan from the Department of Pharmacology, AMRITA Institute of Medical Sciences. And I'm here to introduce you to the lesser known branches of the healthcare sector, which are altogether known as the allied health sciences. Now, before we start our discussion for today, I would like to ask you three questions. 1. Do you think you're quicker than most in an emergency situation? 2. Do you think that you have an interest in medicine and the human body? And 3, which I feel is the most important, do you like to help others and does that fulfill you? If the answer to any of these questions is yes, I would like to suggest that I may have something of interest for you. So I would start this discussion by first introducing what is health and what is healthcare. Who is a healthcare professional? And where do the allied health sciences fall into the spectrum? What are the undergraduate courses available among the allied health sciences, the details of each individual course, and what are the common points such as working place and scope of this course? So what is health? If you ask yourself, are you healthy? Many of you would say yes, just because maybe you have not been to a doctor or a hospital recently. However, WHO says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That is, health has three parts, that is, physical, mental, and social. So what is healthcare? Healthcare would then be the maintenance or improvement of this health. And who is a healthcare professional? A healthcare professional is any trained professional who will help in maintaining your health. So this field includes workers from doctors, nurses, physicians, physician assistants, to even midwives and psychologists. In India, our healthcare plan is divided into 4 levels: primary, secondary, tertiary, and quaternary. So at the primary level, a doctor, a nurse, or any healthcare professional will provide you with the most basic of healthcare, such as immunization and vaccination. In secondary level, you will first be meeting a doctor or a nurse for a specific illness. And at the tertiary and quaternary levels, the specialized care as well as diagnostic techniques are available. This is the level at which the allied health sciences play a very vital role. And I would like to add that AMRITA Institute of Medical Sciences is one of the top ranking tertiary and quaternary care centers in the country. Now, who is an allied health professional? An allied health professional includes an associate, a technician, or a technologist who is trained to perform any technical and practical task to support diagnosis and treatment of illness. In simpler words, an allied health professional is any trained professional who helps a doctor or a nurse in taking care of you or providing you with health care. So the allied health sciences are then divided into 9 broad categories: medical laboratory life sciences, surgical anesthesia related technology, physiotherapy and occupational therapy, nutritional science professionals, ophthalmic science professionals, community care, medical radiology and imaging, physician associates, and finally, health information and management. The allied health sciences course that are available in AMRITA Institute of Medical Sciences is the Bachelor in Medical Radiological Technology, Medical Laboratory Technology, Anesthesia Technology, Cardiac Perfusion Technology, Cardiovascular Technology, Intensive Care Technology, Operation Theatre Technology, Dialysis Therapy, Diabetes Sciences, Echocardiography Technology, Neuroelectrophysiology, Physician Assistant, Respiratory Therapy, Optometry, Emergency Medical Technology or EMT, and finally, Bachelor in Audiology and Speech Language Pathology. I would like to add here that the AMRITA School of Allied Health Sciences is one of the top ranking and pioneers in this field in India. So first, let us discuss what is medical radiological technology. We may have all been to a doctor and they may have told you to get an X-ray or a CT scan. So at the end of this procedure, you would get a film often called as an X-ray film. Now, this film is basically a picture of some part of your body, which helps a doctor to see inside your body and hence come to a diagnosis about your condition. The professionals that are needed to carry out these procedures using these very technically advanced devices are called as medical radiology technologists. These professionals are also trained in the field of radiotherapy. So this course is for 4 years and it will impart you the technical knowledge of very complex devices and procedures like cardiac interventional radiography, computed tomography, commonly called as CT, magnetic resonance imaging, called as MRI, mammography, vascular interventional radiography, sonography, also known as ultrasound, and a new form of medicine called nuclear medicine. At the end of this course, one can apply for the following jobs, that is radiographer, computed tomography technologist, diagnostic medical sonographer, nuclear medicine technologist, MRI imaging technologist, etc. Now let us visit the next important course called medical laboratory technology. You may have been to a lab and they may have taken a sample of your blood, either for taking your blood group or for a test that a doctor has suggested. So the technical staff that is present in a lab, who are responsible for both the handling of body fluids as well as their analysis to help a doctor in diagnosis, is called as a laboratory technology specialist. So at the end of this course, a person can apply for the job of a pathology technician, optical laboratory technician, laboratory manager, a lab assistant, a laboratory testing manager. And I would like to add that this course, like MRT, is for 4 years. Next, we will talk about anesthesia technology. You may have seen in some movies when a patient is being put taken for surgery, they are first made to go to sleep. This process is known as anesthesia. It is a process which is carried out by highly specialized doctors called anesthetists. But an anesthetist requires a team of workers who may help him in this process. So the anesthetic technician, who is an allied healthcare worker, will perform the patient care roles, predominantly assisting with administration and monitoring of anesthesia. For this reason, they have to have extensive knowledge of the techniques, instruments, supplies, and technology of anesthesia. For the same reason, these technicians can also work in the emergency department, intensive care unit, and surgery clinics. So at the end of this course, one can apply for the job of an anesthesia technician, jobs in teaching and education after certain further education, lead medical instrument technician, perioperative care technician, and one must understand that this course is for 3 years plus 1 year of internship. Next, we come to an interesting course called cardiac perfusion technology. Now, you may have heard of a term called the ventilator. A ventilator is also called as the heart-lung machine. So, a ventilator does the job of both the heart and the lungs. Now, for this reason, it is used in certain conditions such as open heart surgery and even in the ICU. Professionals who are responsible for managing these complex devices are called cardiovascular perfusionists. So they are experts of other life support equipments also, such as ventricular assistance device and intra-aortic balloon pumps. The course is for 3 years with 1 year of internship, at the end of which you can apply for the job of a cardiovascular perfusionist, respiratory perfusionist, perfusion technician, perfusion technological consultant, and even teaching positions if you further your education. The next course is cardiovascular technology or CVT. This is a newly developing field of medical science in which we can manage certain cardiac conditions without taking a patient into surgery and opening them up. So this is done in an operation theater which is known as a cardiac catheterization lab. Now, complex procedures like a stent implantation, cardiac pacemaker, etc., which you may have heard of, that is a mesh of wire that is put into the arteries or vessels of a person, are placed into the body without opening the body through a smaller vessel in the hands or the legs. Now, this job requires one to specialize in certain areas of cardiovascular technology, such as invasive cardiology, cardiac sonography, vascular technology, and electrocardiograms. This course is also for 3 years, followed by 1 year of internship. And at the end of this, one can apply for the job of a cardiovascular technologist, cardiac sonographer, vascular technologist, and an EKG technician. The next course is intensive care technology. I hope you have all heard of a term called the ICU. So the ICU is also called as intensive care unit. It is a room in the hospital where critically ill or severely ill patients are placed. So the equipment that is kept in these ICUs is extremely complex and their management requires great technical knowledge. So in this course for intensive care technology, a student will learn about complex machinery and equipment used in an ICU setup. For example, like an echocardiogram or an electrocardiogram, that is the ECG machine that you have commonly seen. Now, the course duration for this is 3 years plus 1 year of internship. And at the end of this, you can get the job of a critical care technician and an intensive care unit technologist. The next course is Operation Theatre Technology. So, what is the job of an operation theatre technologist? Students will be studying about the surgical equipments and machines that are used in an operation theatre. So this may seem like a simple job. However, an OT technician is actually responsible for all the technical side of an operation theatre, from surgical instruments, their sterilization, preparation of a dressing table, operation theatre table, instrument table, and even the anesthesia table. They also have to look after all the drugs that are used in the surgery, the anesthetic gases, drapes, that is the cloth that is used, and the linen that are used in surgery and their sterilization. This course is for 3 years with 1 year of internship. Next, we go to dialysis therapy. Now, to understand what this course is, we have to first understand what is dialysis. So, we have a pair of organs in our body called as the kidneys. These kidneys are responsible for cleaning your blood. So, your blood contains certain waste products such as urea and creatinine, along with excess water. This process of removal of or elimination of waste material and excess water is done by the kidneys. So when a patient has a problem of the kidney, commonly called as end-stage renal disease or CKD, they may require their blood to be cleaned by a machine. And this machine is called as a dialysis machine. So a person who is trained in managing a dialysis machine is also known as a dialysis technologist. So during dialysis, the technician not only has to monitor the device, but also has to manage the patient's vital signs. So dialysis technician can set up, evaluate, operate, and even troubleshoot a dialysis machine. The course details are as follows. So the duration is 3 years with 1 year of internship specifically in the dialysis unit. And the job profile would be of dialysis therapist, dialysis assistant, or dialysis technician. Next, we will talk about diabetes sciences. We must have all heard of diabetes. Diabetes is a very common illness in India, especially in Kerala. In diabetes, what happens is that we have an excess of sugar in our blood. Now, the most common sugar in the human body that is used as fuel is glucose. So when the glucose is too high, it is called as hyperglycemia. And this condition is what is seen in diabetes. So in this condition, this excess glucose will go to all your end organs, such as your hands, your feet, even your brain and eyes, and damage these organs and may even result in death. So diabetes is a very serious illness, and management of patients on diabetes hence requires great knowledge of lifestyle, treatment choices, physical activity that may be applicable here, and the safe use of medications that are used only for diabetes. Further, a person who is trained in diabetes sciences should know how to use a glucometer, know how to counsel the patient of diabetes, and teach them how to use an insulin pump. Now, this course is for 3 years plus 1 year of internship, and they will learn the basics of medical nutrition therapy and basic podiatric care. So like I told you, in diabetes, one of the main problems is that there is end organ damage. One of the organs that is damaged is the nerves of the feet. So a person with diabetes cannot feel their feet. So when they walk, they may hurt their feet, and unknowingly it may lead to an infection. So caring for your feet, which is also known as podiatric care, is an important part of diabetes studies. So you can work as a diabetologist in a clinic or a hospital, a diabetic educator, and even a podiatry assistant. Fine. Next, we come to echocardiography technology. To understand this course, first we have to understand the word echocardiography. So what is echocardiography? Let us break it up. So echo means sound, cardio means heart, and graphy means to graphically represent what you have seen. Now, echo is used in the sense that a device makes a sound, and this sound will be allowed to hit on the wall of the heart. This sound will then reflect back from the wall of the heart as an echo. This echo is captured by a computer and converted into an image, which is then analyzed by a doctor. So this is the process of echocardiography. Now, echocardiography can be done in two ways, either externally on the patient's chest, or the other method is to put a tube inside the food pipe of the patient, also known as the esophagus, and look at the heart from inside. So for this reason, a person who is trained in this technology has to have not only knowledge of the device that is used, but also of the heart and surrounding organs. The course duration is 3 years with 1 year of internship. Next, we come to neuroelectrophysiology. So for understanding this course, we have to first know that our brain controls every part of our body, and it controls our body using nerves, which are basically connections between the brain and the other organs. Now, these nerves carry electrical signals within them. This electrical signal can be recorded by various devices that we have now. So the tests that are done by these devices are EEG, that is electroencephalography, which is basically you will record the electrical activity of the brain itself. Evoked potential, which is basically a method in which you will give a stimulus to some part of your body, and that stimulus will then create a response in the brain, which is read by the technician. Then EMG, electromyography, that is the recording of electrical activity of the muscle. And NCS, that is nerve conduction studies. So this is when you have to assess a single nerve or a single nerve and muscle group. So as you may have understood, this requires knowledge of very complex devices, as well as great knowledge of the brain. So for this reason, a person who is trained in neuroelectrophysiology will actually get jobs not only in India, but abroad as well. AMRITA's neuroelectrophysiologists have had high placement records in international hospitals in USA, UK, Canada, Middle East, and other countries. The course is for 3 years with 1 year of internship. Next, we will see the course called physician assistant. So who is a physician? A physician is a doctor, and anybody assisting a doctor would be called a physician assistant. So a physician assistant is a qualified medical staff who is trained in diagnosis, therapy, and preventive healthcare in all medical specializations. In many ways, they are a mini doctor. They are trained to assist a doctor in taking history, initial examination, and even the diagnosis of the patient. So their roles vary based on where they are working. So they can work as first and second assistants in the operation theater, where they may even do hemodynamic management. Hemodynamic management is basically managing the blood pressure of a patient, if simply put. Wound management, scheduling of cases, and even very complex procedures such as insertion and removal of an ICD, intravenous, and even arterial lines. So the job profile at the end of this course would be of a physician assistant or an associate, clinical associate, clinical researcher, EMR consultant, and clinical application specialist. The next course is a very niche branch called as respiratory therapy. And in this branch, a respiratory therapist or a student of this branch will learn about lungs, heart, and sleep therapy. So pulmonology, cardiology, and sleep therapy. This is a 3-year course followed by 1 year of internship. And this course will cover all the systems that are involved in these branches. That is the heart and the lungs. So at the end of this, you may get a job as a respiratory therapist, a polysomnographic technologist, a pulmonary function technician, a healthcare manager, product trainer, pulmonary rehabilitation specialist. The next course that I will be discussing is optometry. So you may have gone to an optical store and a technician or a technologist may have helped you to find the correct specs for you. So this process of finding your correct power is done by a technician called as an optometrist. So an optometrist can not only conduct vision exams, but they may even be able to diagnose a condition and even assist a doctor in your treatment. So for this reason, they need knowledge of physiology, that is the normal functioning of a body, ocular physiology, that is the functioning of the eye, hospital procedures, and then certain special aids like low vision aids, geometrical optics, and even nutrition. So the job profile, it is a very wide job profile from optometrist, optician, optometry researcher to oculoprosthetic specialist, plastic assistant, and pediatric optometrist. I would like to add here that some of these jobs would require you to go for further studies. The next course is emergency medical technology. This is a very exciting course that I think a lot of youngsters would be interested in. For the simple reason that some of you may feel like you are very good under emergency situations. You need to be quick, you need to think quick, and you need to be able to administer the correct treatment at the correct time. So the concept of emergency medicine is now only developing in India. However, outside in foreign countries, it is a very well-developed system. So for this purpose, like I told you, you not only require the skill to prevent or diagnose or manage an emergency, but you also have to have very good knowledge of the human body. So you may find work in private emergency services, in disaster management, in the mining industry, which are specific industries where emergencies are commonly seen, and international occupational health and safety and emergency services. So the course is for 3 years with 1 year of internship. And in India, you can work as an emergency medical technician or an ambulance technician. Last but not the least is Bachelor in Audiology and Speech Language Pathology. Now, all of you may have seen somebody who has trouble in hearing or trouble in speaking. Now, just because they are not able to speak or not able to hear doesn't mean that they are dumb or they are lesser than you. So for a person to be able to reach their full potential, just to overcome this small barrier, it may help some of us to reach where everybody else may have never thought we will reach. So for this purpose, we have a special course called Bachelor in Audiology and Speech Language Pathology. So these specialists not only require good understanding of anatomy and all the diseases that may affect these areas, but also how to handle such conditions, how to assess the development, and they may even help a child who is suffering and is not able to reach his full potential because of a small barrier to reach where he might have normally reached. So this course is for 3 years and 10 months followed by 10 months of internship. So at the end of this, you may do a specialization. You can either specialize in audiology or you can specialize in speech language pathology, although many people do both. So speech language pathologist, speech therapist, clinical specialist, ENT and audiometry technician, teacher and home tutor are the various jobs that you can get after doing this course. I would like to add that this course is just the bachelor's degree in this specialty, and you can further your studies and even reach up to a PhD in any of these courses. Now, where do we work as an allied health specialist? You can work in a hospital, an emergency room, an operating room, critical care units, outpatient care centers, therapy centers, and teaching institutes. So before I end my discussion, I would like to add that although all of us know very little about the allied health sciences, we must see that these are growing branches. And for many of you may not know this, but for many of you, this may mean an ability to go outside the country, work in places where your demand is high, and get 100% placements. With this, I would like to conclude my talk, and I would also like to thank PG Nair ma'am for giving me this opportunity. Thank you.
Thank you, ma'am, for that very informative and intriguing session. And audience, please do keep track of your queries regarding this topic. We'll be conducting the question answer session after both the set topics. Now, I call upon Mrs. Prini Varghese, lecturer, AMRITA College of Nursing, to share her insight on career opportunities in nursing. Welcome, ma'am.
Thank you so much. Good evening, all. Myself, Prini Varghese, and currently I am working as a faculty in College of Nursing. You are 10th, 11th, and 12th standard students. You all might be having some future plans for you, some areas of interest where you are interested to work on. So here I am to discuss something regarding the career opportunities in nursing. Especially in Kerala, many of the students are joining these courses. Many of the, every time we are getting so many students in the course of nursing. So as nursing is a profession, you should first know what is a profession. A profession is an occupation or calling requiring advanced training and experience in some specific or specialized body of knowledge which provide service to society in that special field. That means for working, for joining any profession, you should be having some training and complete that course. After that, you can join somewhere and give your service to the society. So here I am going to discuss what is nursing. Before moving on, what is nursing and what is a nurse, you should know this. The picture which you are seeing is Florence Nightingale. She is known as the lady with the lamp. She was a British nurse. She was best known as the founder of modern nursing. Every year we are celebrating International Nurses Day on May 12th on her birthday. She had spent her whole life for giving a service to the entire society, and she is one of the other famous personality in the history of nursing, Virginia Henderson. She is well known for the definition she had given for nursing. According to Virginia Henderson, the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. That means the unique function, the function of a nurse is to help the sick or well to become independent as early as possible and make them able to perform the activities of daily living. Now, the categories of nursing education. In nursing education, there are so many categories, starting with auxiliary nurse and midwife, ANM, general nursing and midwifery, GNM, diploma in nursing education and administration, diploma courses in various nursing specialties. Many of these courses you can do even after your 10th. Then post-basic BSc nursing, bachelor's degree in nursing, that is BSc nursing, it's a degree course. Then master's degree in nursing, that is MSc nursing, post-graduation, and Master of Philosophy in Nursing and Doctor of Philosophy in Nursing. This PhD in nursing is the highest level of academic qualification we are having in nursing. Now, what is a nurse? A professional nurse is a graduate of a recognized nursing college who has met the requirement for a registered nurse in a state in which she is licensed to practice. Okay, that means you have to join a nursing college. Then you have to complete your 4 years of nursing. Then you have to register in KNMC, that is Kerala Nurses and Midwife Council. Then you can work, you can join any hospital and you can work as a nurse. The nurse stands for N, nobility, knowledge, U, usefulness, understanding, R, righteousness, responsibility, S, simplicity, sympathy, E, efficiency and equanimity. Equanimity means the equal of mindness. That means any situations come, you should be calm and emotionally stable to handle the situation. So these are the qualities of the nurse. Then the eligibility criteria. Okay. So eligibility criteria for basic BSc nursing. This is a 4-year course. The eligibility for admission is the age should be minimum 17 years of age and maximum 23 years. Okay, so between 17 to 23 years, you can join the BSc nursing course. Then the eligibility is must have passed 12th in the first attempt with a minimum of 60% in English and 60% in physics, chemistry, and biology taken together from any state higher secondary board or equivalent. The candidate should be medically fit. Now, post-basic BSc nursing. Okay, this is a 2-year course. Many of the students are, they in starting, they are taking GNM course. So after that also there is an option to do MSc. How you can do? You can, the candidates should have passed 3 or 3.5 year GNM course with 50% mark in aggregate from an institution recognized by INC. That means after GNM, you can join this post-basic BSc Nursing 2-year course. Okay. Then MSc Nursing. It's a post-graduation program, 2-year course. Eligibility for admission is pass in BSc Nursing or post-basic BSc Nursing with 55% of marks from a recognized university plus 1-year work experience after any state nursing registration. This I already discussed with you. That means after your BSc Nursing, you can register in KNMC. Then you can work as a nurse for 1 year. You have to work with that experience certificate. You can apply for MSc Nursing. In MSc Nursing, you can select specialties are there. You can select your specialties and subspecialties. And the main 4 branches are medical surgical nursing, child health. Child health means pediatric nursing, mental health nursing, and obstetrical and gynecological nursing. In medical surgical nursing, again, there are subspecialties like neuro, oncology related to cancer, then GI, gastro, then nephro is there, cardiothoracic nursing, and so on. So in medical, if you're selecting, you can, under that also, you can select the subspecialty. Then aims of nursing practice. What all are the aims of nursing practice is to maintain the health, promote the health and wellness, prevent illness, restoration of health, that is to restore the health of the client, and facilitate coping. Facilitate coping means make them able to adjust with the situations, and care of dying. That is, it is a responsibility of the nurse to provide a good end of life care so that the patient can go with peace and dignity. Now, role of a nurse. What you are supposed to do under nursing. Trends and issues in the society keep changing. So is the nursing practice and nursing roles. So role of nurse within the field of practice, that means as a nurse, you are having certain few other roles also, like you can be a caregiver. Caregiver means caregiving role is a primary role in of a nurse. You can provide holistic care. Holistic means comprehensive. That means health is a complete physical, mental, social, spiritual well-being, right? Not merely absence of disease. So you have to provide a complete care to the patient. Then you can make clinical and ethical decisions. Then you can act as a protector or a client advocate. That means nurse help to maintain a safe environment for the client. She takes steps to reduce the adverse effects of the treatment modalities and all. Then you can be a case manager, communicator. Nurse is a good communicator, comforter, leader. Nurse should be a good leader so that you can give a good care to the patient. Then counselor in any situation, to the family, to the patient. You should know how to counsel them, how to make them adjust to the situations and conditions. Then rehabilitator. Rehabilitation is a process by which individuals return to the maximum level of functioning after any illness or chronic disabilities. So here you can provide physical therapy, physiotherapy, vocational training, then occupational training, diet, medication, and so on. Then collaborator, the nurse collaborate with other healthcare team to provide nursing care to the client. Okay, then you can be a teacher or educator. After MSc Nursing, you can work as a faculty, like as I had done my MSc in pediatric nursing, then I'm working as a faculty. Or you can, after BSc also, you can work as a clinical instructor in nursing schools and colleges. Then as a nurse also, you can conduct in-service educations and teaching section, training section for the other staffs over there. And health education obviously is one of the main role of the nurse. You have to provide proper knowledge and education to your client wherever there is lacking of knowledge. Then you can work as a research nurse. In the many hospital, research nurse post is available. In AMRITA, it is there. Research nurses are there. And you can be a change agent. Change agent is a person who helps to facilitate or bring positive change in any areas of healthcare. That means if you see any area need to be changed, any new researches you conducted and found that this should be better, so you can work for that, for the betterment of the patient. Then we can see the different scope of nursing services. That means outside the hospital also you can work. But first one is a bedside nurse, providing direct care to the patient in hospital, clinics, nursing home, or other medical facilities. Then you can work as a nurse administrator, a person who manages client care, including delivery of nursing services. That is from the planning, organizing, recruiting, directing. Everything is done by the nurse administrator. Then provide duty nurse, private duty nurse, provide nursing services to patient at home or any other setting in accordance with the physician order. Okay, so if the physician order is there, you can work as a private duty nurse. Then public health nurse, serves the health need of public and deliver care to the community, especially after taking community health nursing. It is also again one of the branch of specialty you can select in MSc, community health nursing. So after doing community health nursing or after writing PSc, also you can work as a government nurse and you can serve the society. Then prison nurse. Prison nurse means the nurse who work in the prison. Okay, and there what she is doing, she taking care of the inmates with medical problems, treat injured person and focus on patients' mental health. Even though they are prisoners, you have to take care of their mental health. Okay, next, home care nurse, provide periodic care to patient within their home environment as ordered by the physician. So sometimes the patient would not be able to go to the hospital for admission. There may be some issues. So they are searching, they will apply for a home care nurse, and as per the physician order, you can work as a home nurse. Then nurse epidemiologist, also known as infection control nurse. In all the well-developed hospital, infection control nurses are there. Direct care, they are not doing direct care, they are not providing, but they are monitoring the standards and procedures for control and prevention of infectious diseases or nosocomial infection. Their main aim is to prevent infection and cross-infection. Nosocomial infection means the infection which is acquired from the hospital. So that type of practices, if you are continuing in any hospital, that will interfere with the health of the patient. So these nurses are looking for that. Now, industrial or occupational nurses. If you are not interested to work in a hospital, you want to work in another setting, you can also apply for in big industries and all. There are nurses appointed. So she is delivering the health and safety program and services to workers or employees over there for promotion, prevention, and protection from work-related hazards. And also the minor first aids and minor primary care she is giving there. If anything serious, she refers them to the hospitals. Then military nurse. This you all might be knowing, very popular and also very much interested also to work in this area. Military nurses serve in most major branches of the military, including Army, Navy, and Air Force. Now, school health nurse. In the hospital or the industry, not only there you can work. In the school also you can work as a school health nurse. Many of the good institutions are having a reserved seat for the school health nurse where you can apply and you can supervise educational success by enhancing health. So what all work you supposed to there? You can work as a consultant. You can check for any issues with the students. You can counsel the student, conduct camps and programs, and for minor ill treatments also you can provide there. If anything, any serious issues with the child emotionally or physically. Accordingly, you have to refer them wherever needed. Then parish nurse or faith community nurse. Though means in your parish or in your faith community also you can practice as a nurse. These nurses integrate faith and healing to promote wellness. With faith and healing, that therapeutic care for the wellness within the community they serve. Okay. Now rehabilitation nurse. We already discussed what is rehabilitation. So what these nurses are doing, those who are having chronic illnesses like cancer or heart issues or renal problems, any chronic illness, they assist with disabilities and chronic illness to attain optimal function, health, and to adopt to the altered lifestyle. So after an accident, anything, if any they are not able to go back to their previous level of health, then you can help them to do so. Then many of you are interested in going flights and all. As a nurse also you can work. You can go to flights, you can work as an aerospace nurse or flight nurse. She provides comprehensive nursing care during aero medical evacuation and airlift flights or in any emergency. Any emergency in the flight, she is managing it, even conducting deliveries. You might have seen in newspapers and all. Now, telenurse. This is very much popular nowadays because of the COVID pandemic. This is very much popular. It carries out telephonic communication with the patient, thus providing response to medical care, treatment, etc. So those who are in a far away or distant places, they can call you and they can talk with you. You can give them the necessary instructions, what you're supposed to do as a nurse, and accordingly they can plan. Then nurse anesthetist. They work with anesthesiologists, doctors, surgeons to provide anesthetics. Anesthetics means the agents which produce local or general loss of sensation or even pain. Okay, so this anesthetics after receiving, but you can do this work as a nurse only after receiving advanced training in accelerated program of anesthesiology. You can join as a nurse anesthetist. The diagram you can see. Then infusion nurse. Now, many of you might be very much interested in putting cannula, putting IV lines, and giving medications through these cannulas. This is very interesting job. I too like that, infusion and all. So these nurses who specializes in the administration of medication, for this also you have to get training. Then you can work as an infusion nurse and you can administer medication fluids through an intravenous line, central line, or peripherally inserted central catheter line, that is PICC line. Okay, so for a long term, we are putting PICC line. Like in cancer and chemotherapy. Chemotherapy are the drugs which are given for cancer patients. For that, the long term, we are giving medications. For that, we can put PICC lines. Then in a radiology department, also nurse can work. Okay, radiology nurses are there. They care for the patient who need to undergo radiation therapy or diagnostic imaging procedures. Then oncology nurse. In any well-developed hospital, we are having oncology department and their oncology nurses are working. So oncology means, no, it's cancer. Okay, oncology nurses care for people of all ages who are diagnosed with cancer, who are specially trained to administer chemotherapy and radiation treatments. Okay. Now, disaster nursing. Disaster nursing means in your school, you might have studied what is disaster. There are natural and human-made disaster, war and all. So in that condition, the nurses are going there and they are managing the emergency situation. For this, the nurses should be they should be able to handle the emergency situation. So they should be able to know how to manage that condition, and they are very skillful nurses. Now, very different thing in nurse entrepreneur. After nursing also, in something related with your nursing background, if you are having creativity, you can invest your strategy to start some business and work as a nurse entrepreneur. Okay. Now, very much interesting, forensic nurse. All are interested in crimes and investigations. These all, many of you might be interested. So in nursing also, you can work as a forensic nurse. What you're supposed to do here, you can handle and preserve evidentiary materials for investigation, which would be investigation, any investigation which you are for success of any crimes or investigation, you need to preserve the evidentiary material properly. Then collect history, proper history helps to diagnose many things. Then assessment, counsel, because this in this area, more than physical, they will be emotionally and mentally, they need support. So you can counsel them and also care for injury. Many of the injuries also you have to take care of. Now you can work as a clinical nurse specialist. In India also, you can work as a clinical nurse specialist, but especially if you go abroad, you will get a high salary and a good position. Nurse with advanced degree education and experience in a specialized area, they are working as a clinical nurse specialist. Their roles are direct line care, consultation, teaching, and conduct researches. Here you can select your specialties: pediatrics, child health, okay, women's health, geriatrics, psychiatric health. Geriatrics means old age people. Psychiatric, those who are having mental illness. Rehabilitation nurse, wound care, pain management. Then oncology, we already discussed what cancer patient, right? Critical ill and emergency room services and casualties and all. Now, nurse practitioner. A nurse who is qualified to treat certain medical condition without the direct supervision of the doctors. It is not there in India. We are not having nurse practitioner now, but very soon it will come, I think so. But in UK and all, you can work as a nurse practitioner. There in the, you can see the specialties like pediatric nurse practitioner, family nurse practitioner, women's health nurse practitioner, adult gerontology nurse practitioner, psychiatric mental health nurse practitioner. So this mental health, psychiatric mental health nurse practitioner and your obstetric and gynecological field, that area you can open your own clinics there. And without the direct supervision of doctor, you can conduct deliveries, you can treat them. Okay. Now, we had seen so many scopes, so you might be having some idea regarding the advantages of nursing, right? So nursing save lives and caring for others, always learning something new. Every day you will learn something new. Then job demand and promising job security. After doing nursing, you will not sit idly. Anyhow, you will get a job. It depends on you, how you are approaching and how you are securing your future. Then higher wages. India, it is little bit low, but it is a good salary if you're working abroad. Then India, if you're getting government jobs, you will get high salary. Then you can choose your own specialty where you are interested in. Then plenty of career advancement opportunities. Feeling a sense of pride as a nurse. Then it's the most trusted profession. Then as there are some everywhere, if with the advantages, there will be some disadvantages also. You should be knowing this little bit, like nursing, sometimes the nurse feel undervalued. In some of the areas, the nurses are feeling undervalued, but now it is changing, but still conditions needed to be changed in some of the areas. Then working with difficult patient. Every day you are not you can't expect that you will get a patient who will contribute with you, who can cooperate with you every time. Sometimes you have to manage those situations when you are getting difficult patient. Then long working hours. In India, working hours is said, but still double duty shifts and everything is there. And abroad also, 12 hours you have to work. But 3 days you have to work, rest of the days you will be having your off. Then challenging conditions you have to see every day. That is a good thing also, but challenging conditions you have to take care of. Then coping with the physical and emotional strain. You have to maintain a work-life balance. If you are working as a nurse, it is not an easy task. Okay, you have to maintain your work-life balance. Then working during holidays. In Sundays also, you can't say today Sunday, I can't come. You can't say like that. You have to work on holidays also. Then exposure to diseases. As you are a healthcare professional, especially the nurse, the nurses are the lifeline of any institution, any medical institution. So you have to work every time, and there will be exposure to diseases. But if you are a good nurse, you can protect yourself and also take care of your client. And as I am a nurse and I am proud to be a nurse, and if you are also interested in becoming a nurse, you have many options when it comes to potential career. The right choice for you will depend on your own personal and professional goals. So it's my suggestion, whatever career you're choosing, it should be as per your interest. Where you are interested in, you have to choose that. Then only you can show your full dedication to that profession. Thank you all of you for your patient listening, and thank you PG madam for giving me this opportunity. Thank you.
Thank you so much, ma'am. That was indeed a very enlightening session. Now we move on to the discussion part of our webinar. I request Dr. Prasad VG sir to take the lead.
Namah. Thank you for the both speakers for very elaborative session on both allied health sciences and nursing. So we have eminent chairpersons join here. So I would like to introduce our respected Madam Nursing Director Bala Madam. Madam, it was a very nice presentation on the nursing profession. So would you like to add something on the
nursing field? Yeah.
nursing?
You go on, Prasad. I'll come after you.
Okay, okay. So allied health sciences, everybody, as Aishwarya explained, it's a very new field that is emerging in India. So recently, the central government has passed the Allied Health Science Act in the Parliament, and new regulations are coming on the field of allied health sciences. So new opportunities, new vacancies, new licensing system, everything will be established for the allied health sciences. So there is a huge opportunity, huge potential is there for the allied health science field. So I would like to encourage all the students to take up this new field in the healthcare. The specialty of AMRITA for offering this allied health science is the multi-specialty hospital that is attached to the college, where all these students are given hands-on training. So that is a one specialty required for this allied health science field. The skills and competencies is very essential for any allied health science professions. So they have to be technically very competent to handle this sophisticated machines that are used for diagnosis and treatment. So this hands-on training during the course period itself is very important. So that is the one peculiarity that AMRITA highlights. All our students are getting hands-on training, and that is the reason every student who pass out from AMRITA is employed, and we claim 100% employment just after your graduation. So, and definitely the infrastructure or the facilities that are provided for training is world standard, and the faculties, all the world-renowned doctors, faculties, professors, they are trained under these eminent doctors. So these are the highlights of AMRITA for training the allied health sciences. So I would like to
Yeah, I think I'll just add on 2 points here. One is, medical science is a vast specialty. So I think most of the people when you think about hospital, you think about doctors. You don't think about everybody else. There's plenty of things that you can do in health care, and hospital is only one small part of healthcare. You can start with working with promoting of health. That means you can do so many things to make sure that you have good health. Then you can actually go on to the next level where you're actually preventing disease, which is more specific. Then you work on curing the illnesses or treating illnesses. Then you work on rehabilitation. So there's a whole spectrum of activities you can do. But what I would like to suggest to all of you is, if any one of you is interested in taking any course in medical field, the one thing that is very important for all of you to look at is that what is the infrastructure available for you to look at the kind of patients whom you deal with. The clinical setup is very important for any course that you're choosing. And what is the amount of clinical hands-on you will get? What is the kind of, what are the number of patients that you will see? What kind of, if you're going in for a allied health science for a particular branch, do they have the latest equipment? Do they allow you to work with it? Are you actually going to be part of the team? So these are important. If you don't look at these criteria, you might get a degree, but you might still feel not be very much employable. Like, you're not fit for employment in a specialty center. So when you're choosing any specialty, if you choose nursing, you choose allied science, you choose medicine, whatever, you want to choose anything, you just look at what kind of population of patients are going to come in that parent hospital. Do you have facilities that you can learn from? And then only choose any specialty that you require. Time is up. I'm sure all of you might be hungry, waiting for your dinner. I don't want to make you wait any longer. If there's any question that you want to ask about any of these, especially with nursing, I really want to emphasize on the point that if anybody is wanting to take nursing, please make sure you go and join a nursing college which is recognized by the Indian Nursing Council. You can get a list of recognized colleges. Don't get into any random college and pay the fee to get as a nursing degree. Make sure you are joining a center which is recognized by the Indian Nursing Council. You can look at the site and you can understand whether this college is recognized. Second thing is that you really need a license to practice in the country. And each state you go, there is a separate license for each state. There's a separate process. But as +2, 10 students, all you have to know is, if you want to choose nursing, you have to go to a recognized school of nursing or college of nursing. You can do a GNM, you can do a BSc. The BSc is a little costlier than the general nursing, but general nursing is also good enough for bedside care in the hospital now in this country. So you can take up any of these two courses to be working in some good hospital. Then all the rest is actually an advanced learning, post general nursing or BSc. You can do up to PhD. You can do a lot of things. There's plenty of scope. There's plenty of, I think Prini has almost covered in nutshell, but there are much more, courses available. Tarun, I am seeing that you are reminding me of the time. Thank you very much. We really don't want to keep you waiting for your dinner. Anybody else has any questions, please let us know and we'll wind off in another 2 minutes.
Anybody want to ask? Either you can unmute and ask, or you can type it in the chat box. We will.
They're all waiting for dinner now. Or you're not in the, you put on the screen or gone off somewhere? Hopefully not. No response. If you don't have any questions also, you can say, thank you, we are off. Armed Forces has a career options after class 12. Yes, they do have. After +2, you can also go into Armed Forces. A lot of courses are available under Armed Forces also in their institution, in their colleges. Ardra, you have raised your hand. You have a question. Please unmute yourself. Otherwise, you can type into your chat box. Entrance exams. Okay. Of most of the, for MBBS and all, there's a common NEET exam. For Amrita, actually, you have a separate entrance for allied sciences and nursing, which is exclusively for Amrita College of Nursing and Amrita College of Allied Sciences. You can go into our website. How hard is to become a nurse compared to doctors? Equally hard. Equally hard, because a doctor is a different challenge, nurse is a different challenge. Doctors, their studies are long, because they probably have to invest more years of academics than a nurse does. Nurse actually is much more challenged emotionally and intellectually than compared to a doctor, because you have to be continuously by the side of a patient who's sick, and you have to be smart intellectually to be as good as any doctor who is specialized in a subject. That's a little bit challenging. But you have if your interest is more towards a person oriented, or more towards a people oriented, you're a people oriented person, your job would be much more suitable as a nurse than a doctor. Also, there's a difference. If a doctor touches a patient, it's a liability for lifetime. Nurses, you can still be afford to, after your 6-hour shift, you can say goodbye and go. They're not going to come after you if you're in the hospital. Some other places, no, it's equally hard. Anybody else? Think it's, yeah. How can we prepare for Amrita entrance exam? I think if you know your basics, right, it should be enough. There's nothing special about Amrita. It's all about your basics, physics, chemistry, and biology. Read well, and you have to know the knack of writing your objective type exams. The mostly are objective type questions. So there's a particular way of working through an objective type question. If you can learn the trick of it, you can pass with a good amount of subject knowledge.
There is a weightage given in our website, no matter how much percentage for the physics, chemistry, biology. So
Yeah.
if they can follow that. And
yeah, basically what you have to know is you have to know these subjects decently well.
yes.
And the second is your presence of mind in writing your exam.
Yes.
Most of the time what happens is you know it, but you're not able to really understand the question in the right manner. That's where you fail most of the time. It's not about the subject knowledge. It's about how you write.
I think that time management is also important for.
Free seats in Amrita institution for MBBS. I don't think we have any free seats for any of the courses. All of them are having fee. Scholarships will be available with different. As of now, Amrita doesn't have any scholarships for any of these courses. Currently, all healthcare courses are only available in the Kochi campus. Rest all the campuses are engineering and other allied science, other sciences, not health science. Health science only Ayurveda, one college, and all other health sciences courses are only available in Kochi. Maybe Faridabad a year later, hopefully. I think, Prasad, I think we can wind off. It's already 8:15. Everybody will be feeling hungry.
Yes, madam. Yes.
If any queries are there, there is a website, amrita.edu. You can go in and look at for all these courses. Informations are available. You can read through and apply for, or ask your queries. There are numbers given where you can reach out to.
Madam, there is one more message.
Uh.
Uh,
Clear UPSC exam without going to coaching by reading competitive exam books. I am not a UPSC coach though. If you, I'll tell you one secret of life. Okay, if you study for the sake of learning, you can write any exam. But if you're actually studying for clearing an exam, for every exam, you will have to repeat the same studies, and yet sometimes you will not pass. I think that's it, Prasad. We'll leave. Thank you. Thank you all for coming and listening and giving us, I think we had almost 96 people when we started. When we get first rank, is the fee not there for MBBS? I don't think there's any difference between a first rank and a last rank in MBBS. You have to get through NEET. Okay, in the NEET, if you get a rank, I don't know, maybe government has something, but as of now, I don't really think there is anything free. The fee is different for management and merit seats, sure. There is a little bit of difference between the fee. So we are not from the MBBS field, so we might not be the right persons to give you the answer.
okay, thank you, thank you, thank you, madam.
Thank you for being a part of today's webinar. I would like to thank our chairpersons and speakers for taking time off their very busy schedules to join us and inspire each and every one of us through their talks. Now, I would like to extend my sincere gratitude to Dr. P.G. Nair ma'am and team and AMRITA Alumni Association Kochi campus. For further queries, audience, please do feel free to contact the speakers and organizers on their phone numbers provided in the given slide. Pharmacy, nanosciences, biotechnology, and molecular medicine are a treasure trove for job opportunities all around the world. With a medical touch but a relaxed lifestyle, these high-paying specialties are eagerly sought after in this generation. Tune into the same link at the same time tomorrow to know more about your career prospects in pharmacy, nanosciences, biotechnology, and molecular medicine by the experts themselves. Looking forward to see you all tomorrow. Thank you and good night.